Drug classification is one of the most important foundations in pharmacology. Instead of memorizing hundreds of drug names, understanding how they group by function or system can simplify everything. Let's break it down system by system. Starting with the nervous system, we have analgesic drugs that relieve pain. These include paracetamol, non-steroidal anti-inflammatory drugs like ibuprofen, and opioids like morphine. Then we have anesthetics, which can be local, like lidocaine, or general, like propofol. Anti-epileptic drugs include phenytoin, levetiracetam, and valproate used to prevent seizures. Antipsychotics like haloperidol and risperidone are used to manage schizophrenia and bipolar disorder. Antidepressants are grouped into stress like fluoxetine, tricyclics like amitriptyline, and MAO inhibitors for sleep and anxiety. Sedatives like diazepam and other benzodiazepines are commonly used. Next is cardiovascular pharmacology. Antihypertensives are a large group, including ACE inhibitors like lisinopril, beta blockers like metoprolol, calcium channel blockers like amlodipine, and ARBs like losartan. Anti-angiogenic drugs like nitroglycerin improve oxygen supply to the heart. Diuretics such as furosemide and spironolactone help remove excess fluid and reduce blood pressure. Anticoagulants like warfarin, heparin, and DOACs prevent blood clots. And to manage cholesterol, statins like atorvastatin are the go-to lipid-lowering drugs. Moving to the respiratory system, we have bronchodilators like salbutamol and formoterol, which open up the airways in conditions like asthma and COPD. Steroids like butinide or fluticasone reduce airway inflammation. Antihistamines like cetirizine and loratadine block allergic responses. In the gastrointestinal system, we have acid reducers proton pump inhibitors like omeprazole and pantoprazole, and H2 blockers like ranitidine. Antiemetics such as ondansetron help prevent nausea and vomiting. Laxatives like lactulose and bisacodyl treat constipation, while antidiarrheals like loperamide slow down bowel movement. For infections, antimicrobials are classified based on what they target. Antibiotics like amoxicillin and ciprofloxacin for bacteria, antivirals like acyclovir for herpes viruses, antifungals like fluconazole, and antiparasitics like albendazole. In endocrinology, diabetes drugs are key. Metformin is the first-line drug for type 2 diabetes. Sulfonylureas like glimepiride, and newer agents like SGLT2 inhibitors and GLP-1 analogs are also used. For thyroid disorders, we use levothyroxine for hypothyroidism and cobimazole for hyperthyroidism. Corticosteroids like prednisolone are used across many systems to reduce inflammation. In chemotherapy, anti-cancer drugs are classified by their action. Alkylating agents like cyclophosphamide, antimetabolites like methotrexate, and targeted therapies